First of all, I would like to pay my high respects to Teacher Wee So Will, who's teaching ECN201. I am Kanutan Rapisai, and this presentation is about COVID impact on South Korea economy. And these are the content. The first one is about the topic. I will talk generally about the topic. The second one, before COVID, is the current situation before COVID-19. The third one is negative impacts on Korean economic. The fourth one is Korean strategy that they use to deal with the problem. And the very last one is conclusions and reference. So the COVID-19 pandemic has exposed just how well country with economic impact of health crisis. South Korea was one of the first country hit by COVID-19, although the country continued to suffer from stubborn and persistent tales of cases, a swift and large-scale interventions by the government. Forecasts suggest that South Korea economic contractions will be markedly smaller than other OECD, which stand for the Organizations of Economic Cooperations and Development country. But the country still faces negative growth, falling exports, and rising unemployment, which President Moon has called an economic wartime situation. So go to the second one, which is economy before COVID. Well, before facing this difficulty of COVID, the economics before COVID-19 of Korea is quite noticeable. After emerging from the 1950 to 53 wars with North Korea, South Korea emerged as one of the 20th century most remarkable economic success story, become a developed, globally connected, high-technology society within decades. Begin the 1960s, under President Park Chung-hee, the government promoted the impact of raw materials and technology, encouraged saving and investments over consumptions, kept wage low, and directed resources to export-oriented industry that remain important to the economy to this day. Agreements to help bolster exports. In 2017, the elections of President Moon Jae-in brought a surge in consumer confidence, in part because of his successful effort to increase wages and government spending. In 2018 and beyond, South Korea will contend with gradually slowing economic growth. This could be partially offset by efforts to address challenges arising from its rapidly aging populations, inflexible labor markets, continued dominance of the growth, and heavy reliance on export rather than domestic consumption. So moves to the third ones, which is talking about negative impacts. So the coronavirus is biting deeply into the South Korean economic event. Authority chased down a fresh outbreak of the bugs from its origin in a nightclub of Seoul's flashy Itaewon district. The latest report from the Korean Development Institute, Seoul's leading economic think tank, began bluntly. The Korean economic is fast contracting as consumption and export decrease on the negative impacts of COVID-19. South Korea number of COVID-19 cases is nearing 11,000, including 259 deaths, low figure when compared with most major industrial countries, but still cause for concern. With more than 100 infections attributed to the outbreak of the virus in Itaewon, a swarming multicultural neighborhood of shops, clubs, and restaurants in Seoul, authorities were looking for thousands of people who might have been in clubs in late April. The fear was that the outbreak could lead to second wave of infection, just as the country seems to have overcome the pandemic with strict testing and contracting. The government remained reluctant to impose constraints that were lifted last week in favor of voluntary social distancing, but failure to follow common sense rule was disappointing. A sign of changing time is that airlines have drastically suspended route and inbound traffic has become almost negligible. Stern government controls as well as declining economic condition definitely discourage passengers with new arrival or test for COVID-19 and then sent to an overnight facility awaits the result. Few travelers have been diagnosed with disease, but authorities are taking no chances. If found worry-free, new arrivals still must spend 2-week quarantine either in government facility for nearly $100 a night, including meals, deposit in sealed packages outside doorway, or with family or friends. So with all of this difficulty, of course, Korean gonna have their strategy. So neither a vaccine nor target treatments are available for COVID-19, and the virus is highly contagious. More importantly, they are asymptomatic patients who are able to transmit the virus. The early COVID-19 screening is the key to curbing transmission. In South Korea, more than 600 COVID-19 screening sites were established, including public healthcare clinic, drive-through center, and walk-in screening site, all of which were capable of performing COVID-19 screening and taking swab sample for reverse transcription. COVID-19 screening site has several aims. One is to identify patients early to halt the spread of the virus in the community, and another is to avoid the possibility of having to shut down unaffected hospital due to the contagion. All patients who visit the hospital, regardless of reason for their visit, were expected to fill out a questionnaire before entering the hospital about any fever, any respiratory symptoms, the history, traveling history, and any history of contacts with people with confirmed cases of COVID-19. Then they were allowed to enter the hospital. Depending on their symptom, the patient who was suspects of having COVID-19 were expected to visit a COVID-19 screening site first or to call the hotline before their visit. COVID-19 screening was performed for patients who were strongly suspected of having COVID-19, as well as many asymptomatic groups with evidence suggesting the possibility of infections. For example, all members of a specific religious group in Daegu, symptom people related to COVID-19 cluster, and all paranoia cases, regardless of cause, were tested for COVID-19. Those extensive screening allowed the early identifications of symptom of mild patients who had viral loads. The relatively low mortality rate due to COVID-19 in South Korea might be the result of inclusions of more symptom or mild case in total numbers of cases compared with other countries. Determining the movement of patient is imperative to prevent further transmission. However, some patients did not disclose their contact with movement. The government used global positioning system, or we can call it GPS, records from the circular phone or credit card record to generate a movement map. Once the movement map was made, the map was displayed on the web or notification was sent on inhabitants in the relevant neighborhoods so they could take additional precautions to monitor people under quarantine. Application on smartphone using GPS data were introduced. So that is all about the Korean strategy. Let's jump to the conclusions. In South Korea, including Daegu, routine life was completely disrupted, and the economy was severely affected. The COVID-19 outbreak is still ongoing. There are many unknown factors that affect the trajectory of this pandemic. Healthcare professionals strongly insist on applying strict methods such as straightening border control, lockdown, strong ban of gathering bans, or exporting personal protective equipment, and strictening infections control measures from the early beginning. However, there have been many conflicts among the interests of popular health policy, religions, and economy, and the opinion of healthcare professionals were not always prioritized, even during this outbreak. The majority of people have followed the rule and cooperated with the strategy used by government. However, there are people who dismiss the severity of this disease, neglect the disinfections guidelines, and violate the rule. There are others who might think this is a good opportunity to make money through cornering a market and hoarding. They hope everyone abide by the rule voluntarily without the needs for enforcement. However, strong penalty, fines, enforcement, legislation, and lockdown might be more effective way to decrease the transmissions of the virus. More to the point, South Korea has kept the fiscal tap open. South Korea province also used creative solutions to ensure that government payout will be recycled into economic and help boost consumption. Despite its relative success so far, South Korea is far from done dealing with the virus or its fallout. The country has been hovering between 100 and 200 new daily cases for over 2 weeks. stocking fear of new outbreaks, Seoul have been forced to restrict business activity. For South Korea, an import-oriented economy that particularly acute risk as the pandemic continue to depress cross-border trade. So this is all what um, my topic is about. Is about COVID-19 in um, impact on e- South Korea economic. And these are the references of the whole presentations about this topic. So thank you, teacher, again for listening.